Welcome to the Oshawa Community Museum podcast with your host, Melissa Cole.
Thank you for joining me on the third of our special podcast series coinciding with the Victorian Medicine Show, which is a part of our monthly speaker series. Though a lot of Victorian medicine was very forward-thinking, some of our artifacts still maintain a certain archaic quality to them. For example, in the 19th century, bloodletting was still quite common. This painful practice would have a sick patient bleed out their illness with the aid of leeches, pointed lancets, or other devices. It was believed by some doctors that the loss of blood could assist in wresting a fever, providing strength and lessening pain from illness and injury. In our collection, we possess a small brass instrument that was used specifically for this purpose. This bloodletting device has one side that contains 10 narrow slits. When a trigger is pulled, 10 sharp knives emerge and pierce an artery to induce blood flow. This object would typically be attached at the elbow or the wrist. As medical practitioners pressed on into the new era of health and disease, many doctors began to argue fiercely over the legitimacy of the practice of bloodletting. In 1850s Europe, studies on the effects of bloodletting in pneumonia patients were released and proved that bloodletting had much less of a positive effect than previously believed. The practice slowly declined over the next few decades and ultimately ceased at the turn of the 20th century. I would like to thank you once again for joining me on this special podcast series, and I do hope you can join us at our monthly speaker series this month on Tuesday, February the 21st at 7 p.m. It will be featuring Nancy McLeod, who is a retired nurse, and she'll be showcasing her Victorian Medicine show. I hope you can join us. Thank you once again.